Welcome to the 2025 Summer Heat Series on Demand, brought to you by the Industrial Athletic Trainers Society Continuing Education Program. Following the video, check the video description for more information about how members can collect their CEU for this video. Let's get started.
We are so excited to see you guys for day number 3 and last of our Heat Hazard IQ summer series that the Industrial Athletic Trainer Society has put together to bring you guys hopefully what has been some very rewarding and applicable and useful education on the topic of heat hazards and heat illness and injury, and how we as ATs and safety professionals are really critical when it comes to being able to prevent and protect workers. So I'm very excited to introduce to you guys to our day number 3 speaker. Today we have Dr. James Daly. He currently serves as the Industrial Accounts Manager for Wellness of Work Days, where he's leading a team of medical providers across the country, serving both industrial and manufacturing clients with on-site well-being, mental health, and injury management solutions. As a certified and licensed athletic trainer and nationally registered EMT, Dr. Daly has over 16 years of experience as a healthcare provider, from NCAA collegiate athletes to professional sports, and serving as a faculty member in higher education as well. Today, Dr. Daly is going to be talking to us about responding to occupational heat emergencies in our day 3 installment, Code Red. Dr. Daly, I'll let you take it away.
Thank you, Susan. I appreciate it. You can hear me okay?
Yes, we hear you loud and clear.
Great. Thank you very much. All right. Well, good morning and good afternoon, everybody. Really appreciate the time and the opportunity to speak to everybody and to enter into a conversation, really. So we're here to talk about responding to occupational heat emergencies. And so just quickly, I don't have any financial disclosures or conflict of interest. I will display and talk about several different products, but none of them are a formal endorsement by any means, and I'm not being compensated in any way to include them. Just what I know that is out there and what has been studied and what has been utilized in a variety of different fields, including athletics as well as the industrial side. So first and foremost, just you can't do anything without a little help from your friends. So a big thanks to Susan and Mike with the Industrial Athletic Trainer Society for asking for the help and the opportunity to present. We'll talk a little bit more about the HSPC, the Heat Safety and Performance Coalition. That's a piece of the Corey Stringer Institute out of UConn, but a big thanks to Dr. Brewer there, whom has been very gracious to me and to continuing to share information there. And then, of course, a big thanks to my team, people covering for me today and helping me day in and day out. But I just thought this was a pretty cool, can't really get anywhere without help from our friends and colleagues. And this little bird needed some help on one of our sites. So that was pretty cool. So just a little bit about me. As Susan said, I've been an athletic trainer and EMT for a long time in a variety of different settings. Have had the opportunity to work with a number of different athletes, both sport performance as well as industrial. And what we're here to talk about today is we've had a great 2 days prior, right, with the two presenters, and really leading up to this. Some of it will be a little bit redundant. But again, as we know, learning over time is really important. Having the opportunity to continue to discuss these opportunities is really something that I'm passionate about and something that I'm gracious for your attention for. So as I, have moved into the industrial setting, what I'm really continuing to look for is the opportunity to take the best practices from any setting that we've been in and really make them fit for what we need them to do. And ultimately, that's to serve our patient, right? Our patient population, our clients, if you will, our industrial athletes. So a couple of the objectives that we'll go over today is just the identification of the signs and symptoms that are associated with any of our occupational heat illnesses. So we'll be referencing both the NATA position statement as well as OSHA. We'll go through some of the pathophysiology of the exertional heat illnesses in the industrial setting to be able to differentiate between the exhaustion and exertional heat stroke, again, in accordance with the NATA best practice. And then the last two, we'll go through a variety of different on-site evaluation techniques and treatment protocols, and that will follow or be in line with OSHA's first aid guidelines, as well as the NATA position statement on exertional heat illness from 2015. And then lastly, we'll take a look and critically assess an existing occupational heat illness prevention plan. It's not one in particular from a specific client, but just something that you'll be able to utilize to critically appraise something that you may have or something that you may feel like you need, again, aligned with the OSHA heat illness prevention campaign and NATA. So just when Susan called and asked me to present, a couple of things came to mind. I appreciated the name of the title in terms of Code Red. So a few good men came to mind there, and then Good Morning Vietnam and how hot it was. Very apropos, and something that you may have seen recently down on the bottom left. This interesting word of the day, kakarathes, which is Greek, which is basically roughly transmitted to unfit to endure the summer heat. And again, I thought it was very appropriate for what we're talking about and how we can help those that may need it the most to be able to endure that summer heat and continue to be successful and continue to be productive. So again, a large part of my career has been focused on high performance. And again, it doesn't necessarily matter what setting I have been in, been trying to deliver over a prolonged period of time, meaningful, measurable, and financially sustainable results for the people, the causes, the build, whatever it may be. And so how do we do that? We put together a set of behaviors and values and norms. And I think that's a huge piece of what we are all trying to do and what we're striving to do in this setting regarding heat, because there are so many different aspects to it, right? We have the NATA, we have OSHA, we have NIOSH, we have the AIHA, and the Corey Stringer Institute, of course. So trying to meld a number of those things together to make sure, again, that those people that are coming to work, whether it be in agriculture, manufacturing, industrial setting, what have you, are able to go home each and every day and be productive, happy, and safe. So I think we're probably all, most familiar with these four individuals. And the reason why I bring this up, or I put this slide together, is one of the things that I see a huge difference between professional athletes and basically everybody else is their ability to continually perform at a high level each and every day, right? And that comes down to a variety of things, but ultimately it is the recovery piece. So the term that is out there in the industry, the one that I prefer to use is repeatability, right? It's a high level of repeatability day in and day out, perhaps multiple times a day. And so I want to keep that in mind as we go through talking about heat illnesses, of course, when we talk about treatment, but also our number one domain, right, as athletic trainers, being prevention. How can we help prevent and treat these things so that individuals will have the opportunity to repeat their effort and repeat their work day in and day out? It is not always the first day that it is hot where people are typically impacted, right? It is maybe the second or the third day where they have not had the ability to recover, and they start to get into trouble, whether it be through their dehydration, which Susan talked quite a bit about, or their opportunity to dump heat, and we'll continue to get into that. So I think, again, most of us here are very familiar with what we know as the occupational athlete or the industrial athlete, right? Again, whether it's manufacturing, construction, warehouse, agriculture, what have you, there are a lot of different aspects to the job, and this is whom we are typically working with. And we cannot stress enough to treat them as athletes, right? They deserve the opportunity to fuel appropriately, recover appropriately, and be treated as such because of the work that they are doing day in and day out. Of course, we know is physically demanding, mentally demanding, stressful, and we the expectation is there in the industries that this work continues day in day out, regardless of the environment, and we want to be able to continue to help these individuals as much as possible. So this is something that I've come up with and I've talked about on a couple of presentations. Something that I like to refer to as heroes work, and you can see this across the industry, across occupations, but work that these individuals are performing are a number of these things, at least one, right? It's heavy or physically hard. That could be for an 8-hour shift, a 10-hour shift, 12-hour shift, or it could be a couple of hours of that shift. Of course, we'll dive heavily today into the aspect of this, the environmental conditions, particularly those that are very hot. Again, we're asking individuals to perform tasks repeatedly, and so that is where we start to build up heat, of course, and mental focus becomes a huge aspect when we talk about psychological safety as well, having the opportunity to stay focused on the task. Um, we talk about musculoskeletal aspects, overhead, awkward positioning, or something that is very specialized. But just wanted to share this. I hope that this is impactful, something that you can be able to use on your job site or with your athletes in the future. All right, so just some background. Again, I think we all understand that it's hot and it's getting hotter, particularly in the summer months. But in 2023, the EPA estimated that extreme heat, which they define as greater than or equal to 95 degrees Fahrenheit, is responsible for over 1,300 deaths annually in the United States. Of course, that is across populations. That is not specific to the industrial setting. But again, heat is not discriminatory, right? It will impact anybody that is exposed to it. And again, unfortunately, I think the discrimination or the discriminatory part comes into the recovery. And we'll get into that. Those potentially underserved populations that do not have the opportunity to recover as fast as others. In the U.S. is per the EPA is actually expected to continue to warm faster than other parts of the world. So we have in this country an average temperature that has already risen more than 60% above the global averages in the last 50 years. And many parts of our country are projected to experience much longer stretches. So I think, again, that we're all maybe not getting used to that, but starting to see that, right? What we're seeing in the media known as the heat domes, or just prolonged periods of heat where there is no opportunity to cool off. And so I'm based in Boston, and our nights are not typically very warm, but I have the opportunity to move to many of our different sites throughout the country, and it's still very hot at night. And of course, that does not allow any of the infrastructure to cool down. And again, when we get into talking about repeatability, it does not allow the opportunity for people to cool down either. Again, just some highlights and some headlines from across the country. We know that the Midwest is probably the area that is heating up the most, all the way from Texas, up through Kansas and up into the Dakotas. But of course, the Southeast continues to be hot. I'm sorry, I think you lost my sharing for some reason. Let me double check this. Not sure why. So Susan, it looks like I lost opportunity. Here we go. Not sure what happened there. I apologize. All right, we're back now. try to keep an eye on that. Thanks for the update. Apologies. So just refreshing, again, we know that the southeast is extremely hot, and of course the southwest. We're starting to just see that heat creep more northern, right, throughout the country. And unfortunately, we have populations throughout the country that are used to the heat. It's getting hotter, so they're not acclimatized. And the same could be said for any pocket of the country where it's continuing to get hotter. They do not have the ability to acclimatize as quickly. So one particular study that is personal to me that we had an opportunity to participate in with one of our clients was done last year in August. It was on a Midwest commercial job site, particularly industrial athletes, construction workers. Not a huge sample size, just under 200, and they were utilizing core temp sensors. Again, there's definitely some standard deviation regarding that. But what I thought was really interesting that came out of this is that over 60% of the individuals that were a part of this study, they also did pre-work urine to assess their hydration status. Over 60% of the individuals came into work dehydrated. And I think anybody on this call that is also performing urine analysis or drug screening on site, that probably does not shock. The amount of individuals that willingly know that they are dehydrated because they don't fuel properly, or they're just unwilling to have the opportunity to take a bathroom break or whatnot, is really, really astounding. And I think, again, going back to the first 2 days, that has been a huge point. And the more education that we can do and to educate individuals on how helpful it is to hydrate. It is not just about heat, right? It is about productivity. It is about mental health. It's about overall organ function. The more that we can do on that, the better. It seems so easy and so obvious, but continuing to try and tell that story and show why it is so important, I think will never be overplayed. So 2 things that I really want to make sure that we're focused on today is understanding that we need to do a good job in monitoring the environment, but we also do need to do a really good job in monitoring the employees. And I think it's been my experience that a lot of us or a lot of the clients are really focused on the environmental monitoring, right? They want to know how hot it is on site, what zone they're in, what the work status is going to be, but we're not necessarily focused primarily on how the employee is responding to the environment. So 2 really main takeaways here that I want to continue to think about when we get into the environmental heat stress policy towards the end. So on the left side, when we're talking about assessing the environment, and again, Susan did a great job of going over this, so some of this is certainly verbatim, but we have to take into account the wet bulb globe temperature, right? And that accounts for the ambient temperature, the humidity, the direct sunlight, as well as the sun angle, how much cloud cover there is or none, and then the air movement. So we have to make sure that we are monitoring that. And of course, if we can do that on site in multiple different areas where people are going to be working, if it's different fields, if it's different manufacturing floors, if it's different levels of a superstructure, that is imperative because we know that things change hour to hour, depending upon if things are closed in, weather as well. When we talk about the environment, we also have to look at the physical capacity and the workload of the individuals there. We have to take into account the schedule as well as what is required or what is being worn. Are people dressing for a cold weather morning and then not having an opportunity to change, or are they required to wear heavy PPE? Again, something to consider when we're discussing the environment. One of the other things that I think we do really well in the athletic realm that I hope most of you have been able to do, certainly something that I'm continuing to work on, is the opportunity to prepare for heat stress and to do a lot of forecasting rather than just worrying about the environment day of, and trying to take a look at those employees and their activity monitoring day of, trying to forecast, right, in the construction setting and manufacturing. I think the clients typically have a really good sense of their schedule, what is being phased in and phased out, and so keeping in mind the weather, particularly the hot weather, as a piece of that is really, really important. So again, I know Susan talked about the Kestrel device, and again, that's something that I would certainly that we utilize on site, and something that I'm very comfortable utilizing to be able to get a number of different pieces of data, particularly the wet bulb globe. The surface thermometers, which you see there at the bottom, I think are always impactful. Again, wet bulb globe is certainly going to be your gold standard, but having the opportunity to show uh, administrators or senior, EH&S professionals, how hot it is in different areas just on the surface, not into account the ambient temperature or anything like that, I think is really important. And then this picture on the left I thought was beneficial. This is actually an example from Singapore, where they do not have a government entity like OSHA. They have something that is called the Ministry of Manpower, which I thought was very interesting and a great term for all of their industrial employees. And so they actually have an example here where they broadcast the wet bulb globe temperature for all to see. And again, I think that is really important as well, because it may not just be enough to track it, right? We have to make sure that we're documenting it, because God forbid that there is an incident on site. This documentation is going to be critical, right? It's going to be critical to helping say that we were assessing the risk appropriately and we were doing everything that we can to mitigate that risk. And it's going to keep everybody on site honest to be able to say, well, we were tracking it, this is where it was, and this is what we should be doing. So I always appreciate the opportunity to broadcast this information into the public setting. And so this is, I thought, a great way to be able to do that there on the left. So we'll go back a couple of slides and we start talking about assessing the employee. We have to really think internally on a number of things. And again, I go back to day one, where Susan was talking heavily about acclimatization and where the individuals are. Are they coming off of a layoff? Are they coming off of a job transfer? Have they been working in this heat for a period of time? Where are they in that acclimatization status? Again, I talked about the hydration status from the previous study. Again, pre-existing medical conditions we will dive into. If you're able to do any type of health monitoring on site and you have the opportunity to collect pre-existing medical conditions, that is so helpful for a variety of reasons, of course, but ultimately for heat illness as well. And we know, again, from day one, we'll continue here today, that heat is going to exacerbate any underlying medical condition. So important to be able to assess those, know those ahead of time. Any use of medication, supplements, beta blockers, diuretics, those are, again, all going to predispose an individual that is going to get hot. Beta blockers are going to try and slow down the heart. Diuretics certainly will increase the fluid output, and anticholinergics are going to slow the use of acetylcholine. So again, they're utilized in a variety of different settings, but they can certainly predispose somebody a lot more for heat stress. We know the old and the young are predisposed for heat illness. Again, overall health, I go back to the NATA exertional heat illness position statement, where it talks about viral infection as well as gastrointestinal illness. Anybody that is currently ill or coming off of an illness, we certainly want a red flag. And Again, depending upon the number of people coming on site, that is really hard to track, but keep those things in mind. Those that are not do not have a high fitness level, or those that are obese certainly have difficulty dissipating heat, dealing with the heat. Again, alcohol, drug consumption certainly can predispose somebody. And then I could have put this really in both sectors, but I think it fits more so with the individual employees rather than the environment, because I think oftentimes when we're on sites, whether it be EH&S or whomever we're working with says, yes, we have cooling stations, we have water, but do the employees actually have the ability to access those things? Are they in the appropriate areas? Do they have the blessing from their foreman, their supervisors, whomever, to be able to absorb or engage in that safety culture and step away from work when they need to? And I think that's a huge aspect of it. So it's not just to check the box, right? Hey, we have a cooling station, we have electrolytes on site, but are people actually utilizing it? Do people have the ability to access it timely? Because it's no good then, it's no more than just a paperweight essentially in the corner if only the people in that particular area of the field, of the superstructure, of the manufacturing floor, what have you, have the ability to step away because of the proximity. So again, something to keep in mind when we are assessing the employees is their access. A number of things here that I did not mention. Certainly stress, sleep is a huge factor of this, right? When we do not get adequate sleep, the body is trying to recover itself. It is much more predisposed to have heat-related illnesses. And again, we'll talk about the PPE as well. So this is a graphic that the Heat Safety and Performance Coalition has put out, and they've done a number of studies, particularly with the labor union and labor group. Heat is the #1 cause of exertional-related deaths amongst laborers throughout the country. And we know that it is not just the productivity or a heat illness on site that is really going to be the cost. We know that heat illness can cause long-term neurological deficits. It can cause cardiac deficits. It can cause skin as well as organ damage. It can decrease work output for long periods of time, and certainly is going to have a large impact on the musculoskeletal system as well. So again, I think the more that we can educate EHS individuals as well as tradespeople, manufacturing floor employees, as well as agricultural employees, the better, because hydration and exertional heat is something that is going to impact them for potentially the rest of their lives if they do not take it seriously and we are unable to provide them the adequate resources. It is not just the day that they're going to lose, the day's pay, a couple of days in the hospital, and be right back at it, right? These can cause long-term effects. Of course, we know that they can be fatal, but short of that, they cause detrimental effects in the long term. So as I mentioned, in terms of our #1 domain as athletic trainers is prevention, right? And so we're going to have the opportunity to talk about the treatment or how to utilize treatment protocols to prevent heat-related illnesses and injuries, and then to prevent heat-related fatalities if they do get to that space. I don't think that this is groundbreaking, but again, just bring your attention to it if you have the opportunity to assess your employees or your particular sites. What are your employees able to wear and what are they wearing? So on the construction sites, I'm particularly used to seeing individuals wearing high-vis, but it's often high-vis cotton t-shirts. And while cotton is very light, it does not wick moisture away very well. So as soon as those cotton t-shirts get wet, they typically stay wet, and they do not allow cooling as effectively as moisture wicking material. So just something to keep in mind if it, again, if that's a good incentive or a piece of education to provide, that's something that's very common that I see. The use of vented safety helmets certainly can help rather than a non-vented safety helmet. Any type, if you have to wear PPE, utilizing appropriate reflective vests. They come in all different shapes and sizes and materials, so anything that is mesh and as lightweight as possible. We'll also talk a little bit about these sunshades, again, whether that's in the agricultural fields, or if you have the opportunity in manufacturing where there's direct exposure to light, something to keep in mind. And then again, anybody out in the atmosphere that is going to be exposed to the sun, certainly want to be able to utilize broad spectrum sunscreen as a best practice. So we'll jump into the meat and potatoes of it here, and outlining the objective number 2, or 1 and 2, where we have the list of occupational heat and illnesses. Go through all of those, talk about their pathophysiology as well. So I think again, all of us should be familiar with these categories. Heat cramps, right? They're not they're not essentially what we're used to with a muscle cramp, right, where a muscle is being overworked. This has to do with the muscle being overheated or a body area being overheated. So we will see those muscle spasms and pain. Heat cramps are typically larger in case than just a specific muscle cramp. So you might see an entire arm or an entire leg where those large muscles are trying to dissipate heat and are not having the ability to do so. So again, that's where we see heat cramps, and this is going to be at the most minor level, but again, something to keep in mind that, of course, heat cramps can increase to rhabdomyolysis or to heat exhaustion, and then unfortunately, ultimately to heat stroke. Heat rash, where we're just getting those red bumps, they're often caused by rubbing of the skin or in skin folds where heat is unable to dissipate. So it's just moisture being trapped, and the sweat ducts are being clogged, essentially. So some quick treatment for heat cramps. Again, typically and likely it's a first aid scenario on site. So when we're talking about OSHA reportables and recordables, anytime that we have the opportunity to rest and stop activity, right, remove them from the activity, allow them for full rehydration. At this point, with just heat cramps, they should be alert and coherent, so they should have no problem taking oral electrolytes. Move them to a different area of site, or of the building or of the field. Get them to shade. And again, something to continue to assess for your environment is, does shade exist throughout the day? And is it always accessible? Does it get closed off for an exclusion zone or whatnot? Move them to a cooler temperature, stretch and massage the affected areas. One thing just to point out on this photo, and this looks like a much colder climate, just given the PPE the individuals are wearing, but something that I'm starting to see more and more is wearable hydration packs on site. So if there are areas like potentially a roof or a field for agriculture that are not easily accessible, this is a great way to increase adherence to hydration individually, is to have the opportunity to provide them an individualized hydration pack each day that they will be able to utilize if it is not, a group water cooler or individualized electrolytes. Again, the athletic trainers on the call should all be familiar with rhabdomyolysis. We're talking about large muscle pain. So rhabdo is where the skeletal muscle is being overworked to an extent, running out of fuel, starts to break down itself as a fuel. And so we have overall large muscle pain in our large muscle bodies, generalized weakness, and the telltale sign is always extremely dark urine, which you can see here, tea-colored or coffee-colored urine. Unfortunately, it is not very good sign when you're out in the field, right? You may not be able to get a urine sample at that point. So when we're talking about assessing the environment as well as the employees and the patients, what is their workload? How often are they having to do those repetitive tasks? Is it heavy lifting for a long period of time where they're working the exact same muscle groups and muscle bellies? for long periods of time, that's where you're going to start to see rhabdo. And then kind of building from there, not necessarily one more important than the other, heat syncope, where we get into distress, and fainting, and dizziness. So just circling back, treatment for heat rash, again, likely first aid. We want to just allow the area to essentially breathe, right? Open it up for evaporation, get that moisture out of there, allow good, adequate air movement. We could certainly use oral over-the-counter pain medication if necessary, as well as oral antihistamine over-the-counter as needed, and a hydrocortisone topical as needed could be utilized. And again, those all fall within first aid as long as they are at the over-the-counter level and not a prescription level. For heat syncope, again, potentially first aid. Hopefully, if we can treat it appropriately, we want to make sure that we're monitoring vitals. We want to assess for any underlying cause, and we'll continue to talk about that. That we don't, just because it's hot, we don't want to get too hyper-focused on just the heat, and something else may be going on, and we're just treating it like heat syncope. Again, if they are conscious, if they are starting to become responsive, we want to make sure that we're rehydrating slowly if they are responsive, and we want to try and elevate the lower extremities, bend the knees, if they, again, have the ability to do so, start to treat them for shock so that they can get those fluids. It's typically a hypotensive situation as well. So start to get some of that blood flow back to the core. All right, and then as we move forward into some more of the serious situations when we talk about rhabdomyolysis, this is going to require medical treatment. So again, something that we can prevent when we're talking about forecasting in the heat forecasting phase of work. Rhabdo is going to require transport, medical hospital stay potentially. Rest is going to be of the utmost importance. Pain management, that muscle tissue is breaking down. Again, I've never dealt with it personally, but from what I hear, it is extremely painful. This is going to require aggressive fluid replacement, typically by IV, which will make it an OSHA recordable. And the need to do that is to be able to prevent kidney damage. The proteins that are being broken down from those skeletal muscles will overload the kidneys and could potentially damage it or cause kidney failure. And if that is a possibility, then individuals that suffer from rhabdo may have to go on dialysis. So again, a very serious situation, something that we see in athletics quite a bit, but something that we do not want to forget when we're talking about lifting heavy loads or being in awkward positions, repetitive tasks, day in and day out, especially in the heat. All right, and then jumping into objective number 2, we talk about the pathophysiology and the difference between heat exhaustion and heat stroke. So in heat exhaustion, we're typically going to see heavy sweating. You often do not see a lack of. That is typically when you get into heat stroke, but we'll talk about that further. You may have a pairing of heat exhaustion as well as heat syncope. So again, they're not really well defined between the two. Weakness and overall fatigue, right? These individuals are not feeling well. They have headaches, dizziness, nausea, vomiting. Again, those are all signs that they could be exposed to a vapor in the area as well. So just because it's hot, please make sure that we're utilizing differential diagnoses and kind of keeping our net wide when we're talking about these illnesses. Individuals that have heat exhaustion are typically tachycardiac and hypotensive. So you're going to see an increase in heart rate, but a decrease in blood pressure. Heat exhaustion, they typically do not have any CNS dysfunction, so they should be a high number on the GCS. They should have no deficits there. The skin is typically cool, pale, and clammy, so you do not have the telltale signs of heat stroke yet. Excuse me. But of course, we know that heat exhaustion left untreated in the same environment will likely turn into heat stroke. So if we're able to catch it here, that is a really better outcome and a much better opportunity for us to cool and to treat it. Of course, when we're talking about heat stroke and treatment, we want to dump heat as much as possible. So move them to a cooler area, get as much off of them as possible. So if they're wearing coverings for sun, again, move all of that off. If they're wearing helmets, move all of that off. If you can get shoes off, again, we want to expose them to as much air movement as possible, as much shade and cooler temperature as possible. And if we have the opportunity here where people are still at a high level for GCS, utilize passive cooling. Again, that could be just free-flowing water over them, cooled water, or utilize the old technique of ice packs on those large surface areas in the neck, groin, armpits, knees, and ankles, or a combination of each. At this point, again, with no CNS dysfunction, individuals should be able to push fluids appropriately. Again, we do want to be conscientious of how quickly they're pushing fluids. I know Susan talked about this on day one. We don't want to push fluids too quickly if they are nauseous, because then they will just end up vomiting them, and then you're in a tighter spot where we're talking about hydration status. So try and tailor the treatment to the individual and what you're seeing. Utilize as many different opportunities and options as possible. Okay. One thing that we could utilize in treatment of heat exhaustion, but more likely I'd like to see this used as a preventative technique, is the use of upper extremity cold water immersion. So you see a depiction here. It's very useful for cooling on site, but this should not, and I can't stress this enough, this should not be utilized as an effective treatment in a heat emergency. And we will talk about heat stroke when we get there. The U.S. Army Research Institute for Environmental Medicine put together this arm immersion cooling system, which is what you see there as the acronym AICS, and where they will submerge bare hands and forearms past the elbows in water no colder than 35 degrees. And they are seeing within 3 to 5 minutes or 5 to 8 minutes, depending upon the range of the temperature, that individuals feel relief from the heat stress. So if you do not have the opportunity to set up a cooling station, because as this is depicted that it is road work or you're out in the field, this is certainly something that you would be able to utilize with 2 to 4 to 6 to 8 large coolers where individuals are able to cool their hands and forearms and really be able to feel the effects in a short number of minutes. So then lastly, when we jump into heat stroke, of course, we know the heat stroke is a medical emergency. We see core temperatures greater than or equal to 104. We have CNS dysfunction, so confusion, again, altered mental status, potential seizure or collapse. When we talk about heat syncope, again, all of these things can be paired together. That cool, clammy skin typically tends to be very hot and dry, or it can profusely sweat. I think there are some misnomers out there regarding heat stroke, that it is always dry and that people have are no longer have the fluid to actually sweat. You can still be profusely sweating and be into a heat stroke environment. Again, individuals are tachycardic as well as hypotensive on their blood pressure. One thing, if you're not familiar, from the NATA is the heat stroke treatment authorization form. And again, going back to day one, where we talked about rectal thermometry, and I know that it can be an HR issue, it could be a union issue, but I would heavily encourage athletic trainers to utilize this form, whether they are able to determine core temperature through rectal thermometry or they are not. Again, this is a risk mitigation strategy for us as professionals, those that are working in licensure states where they are required to have medical oversight. This is a really great form to have. So I just wanted to put that out there. And I'm sorry, I'm sure it's probably not clickable on your end, but it will be when the slides go out. But you can certainly search this through the NATA heat stroke treatment authorization form, if you're not familiar. So when we're talking about assessing the patient, again, heat is going to exacerbate any underlying condition or personal medical event. So those that are diabetic, the heat is going to increase their glucose instability. It is going to promote a state of dehydration, which is going to increase concentration of glucose. So you can either go high or go low here, depending. And those that are diabetic typically have poor thermal regulation. So if you're aware of that status of their underlying medical condition, that's important to note. Any type of cardiovascular disease, of course, when we are trying to dissipate heat, we're trying to vasodilate close to the skin, so heart rate is going to increase. So anybody that's predisposed to an arrhythmia, has hypotension, possibility for AFib, something to keep in mind. Respiratory diseases like COPD, any type of shortness of breath, again, are going to be exacerbated from heat. We talked about rhabdo, but it does not have to be rhabdo or full-blown rhabdomyolysis to be impacting the kidneys. Prolonged dehydration is certainly going to increase the risk of poor kidney function, and then, can provide an electrolyte imbalance for those that are exposed to heat. And then, of course, we can't forget mental health because it does impact everybody and every facet of our work. And I think we can all attest anecdotally that as it gets hot, people tend to exacerbate their anxiety, their irritability, their confusion, as well as their aggression. So keep those things in mind when we are assessing patients that may just be off their baseline. Why are they acting this way? Is it due to potentially a heat illness that is continuing to grow? So when we are called out onto scene, or we have a patient with us wherever we're treating them, we have to go through our primary survey. Please make sure that we're assessing the Glasgow Coma Scale. Anything that is going to be 12 or below is certainly going to warrant a call for EMS. And that may even be a pretty... that line in the sand, could go one way or another, but I would be focused on 12 or below. Again, what is our emergency action activation? Is that 911? Is that safety on site? Is that the client's safety? Whatever it may be, please make sure that you're familiar with that. Of course, we need to go through checking airway, checking for breathing, checking for circulation, and as quickly as possible, remove them from the hot environment. We want to quickly get an assessment of the skin. Is it pale, cool, and clammy? Is it hot and flushed? Is it dry? Is it wet? Where are we? That can certainly give us a good indication of their status. Try and get a pulse as well as a BP quickly as possible. And then again, are they continuing to sweat, or do they have absence of sweating? If it's 95 degrees out and 100% humidity, and this is 6 hours into their shift, why are they not sweating? That could be, again, a very telltale sign of something that's not right. I know we get very focused on cooling, which we're going to get into, but some other things to consider if we are talking about heat exhaustion and or heat stroke, things that we want to make sure that we are assessing in our patient, and pulse oximetry is certainly one of them. If you have somebody in a tub that's doing cold water immersion, they likely need to be on supplemental oxygen. So if you're getting an appropriate SAT, please keep it in mind. Please have it on hand. But if you're getting anything equal or lower to 94 on atmosphere air, please make sure that you're onboarding supplemental oxygen. Something that I haven't pointed out that I know has been talked about is heat in the area if they're working next to machinery. And so let us not forget that heat illness could also be paired with carbon monoxide poisoning, where your O2 sats are going to show very normal, and you may still need to supplement oxygen. So again, keeping that wide net, continuing to think about differential diagnoses and why these things are occurring with these patients, and not get hyper-focused on one thing like environmental heat. pulse, if you're getting something low on pulse ox, high flow oxygen with a non-rebreather, 12 to 15 liters wide open, is probably going to be your best case there in an emergency situation. I would certainly recommend skipping nasal cannula altogether if you're in an emergency situation. They're just not going to be able to push enough oxygen. We know rectal thermometry. We're going to get into that. Please make sure that we're utilizing that if you're able to on site, if you're authorized, and then leave it in for continuous monitoring. That's the only way that we're going to be able to tell, have we cooled enough? Have the opportunity to assess glucose levels, right? Have a glucometer on board so that you can do an instant glucose. Again, trying not to get too focused on the heat. It could be heat and something else, right? Are they having a head trauma? Do they potentially have a massive internal or external bleed? And that's why we're thinking it's heat syncope and they passed out, but something else is going on. So please keep that in mind. Is this myocardial infarction? Is the patient responsive? Do we need to onboard aspirin? Is it paired with an exertional heat illness as well? And then, of course, anytime that we're monitoring a patient that is lacking response or cognition, please make sure that we are monitoring for shock. So just from the NATA position statement from 2015, we know that the assessment of rectal temperature is the clinical gold standard for obtaining core body temperature for patients. And it is the medical standard of practice, and it is the only accepted protocol. There is no other in-field method that is effective, that is valid, or reliable as rectal thermometry. So please keep that in mind. If you have only been exposed to it in school or on a presentation, I would highly encourage you to reach out to some of your colleagues, have an opportunity to take a look at one, potentially utilize a model to practice. It is a recommended depth of only 10 centimeters, and these probes are extremely long, right, so that we can utilize cold water immersion while we are cooling them. And again, we want to make sure that we are monitoring that core temperature appropriately throughout cooling. Just a quick depiction. I think many of us are familiar that most of our heat is generated through the trunk and through the core, where the organs are, where the large musculature is. But of course, if we know where the heat is coming from and what is turning up the heat, we're going to have a much better chance to be able to mitigate it. Again, when we start talking about trying to do our primary survey, trying to get oxygen on board or pulse oximetry or glucose, trying to get them into a cold water immersion if necessary. Don't be so hyper focused on getting them in there. Make sure that we're removing as much as we can. Again, that includes all PPE. If we can get boots off or shoes off, great. Right? We're all familiar with the $2.50 pair of paramedic shears that can be our best friend in an emergency situation. So please keep that in mind. We want to increase as much surface area as possible to cooling, and we'll talk about it a little bit here in the near future. But if we're keeping as much clothing on as possible, we're just going to increase that thermal barrier, and we're not going to be able to cool the individual as effectively as possible. So the last piece, as we go through just a couple of products here that if you're familiar with, or if you're not familiar with, that I've seen used on site that have appropriate cooling opportunities. The first one here is a Polar Life Pod. It is something that can be unfolded, right, and filled. So it is something that can be very easily carried. This is a study from 2023 out of the Journal of Athletic Training that showed that the Polar Life Pod had very similar and ideal cooling rates compared to a stationary tub. So it, in this study, claimed that it was an effective tool for treating exertional heat illness when limited water volumes and portability are concerns, and they typically are concerns in the industries that we are all working in. Again, no matter what type of cold water immersion or cooling system that you are utilizing, please make sure that you have rewarming tools and strategies on board. It is not common, but it is certainly something that you do need to consider. Again, Polar Life Pod can be unfolded It does need to be filled with 40 to 60 gallons plus ice, so that could be a barrier, but this does help insulate against any other type of thermal barrier as well as additional heat. So just one option that is out there that I wanted to share. I think this is the newest product out, and this was recently studied from the Corey Stringer Institute in August of 2024. And let me say this very clear, that you'll see in the quote down below, that this is not a viable treatment for exertional heat illness. Okay, this is a viable treatment to be used in the rapid cooling during transport or in remote work where cold water immersion is not available. Cold water immersion is always going to be the gold standard. It is something that we should always assess, that we should always have the opportunity to use. But in the event that an individual has an 8 to 10 minute drive to cold water immersion because of site space, this is a really great option. If you're not familiar, Cold Vest is a one-time use. It will absorb any type of liquid as long as it is not carbonated or alcoholic. It does not have to be chilled liquid. It will absorb it and it will cool hyperthermically. So it has a proprietary urea substance inside of it. It can cool down to, I believe, 34 degrees, and it can be effective within 10 minutes. It will start cooling within 2 to 4. Again, not an endorsement, but something that certainly could help. If you're in a large site where you're driving a work vehicle, this is a great opportunity to put, in the bed of the truck or in the cab, so that you have access. This only requires up to 2 liters of fluid in order to actually hit its effective cooling ratio. But again, I just want to reiterate that this is not a viable treatment for exertional heat illness. This is only a viable treatment for rapid cooling during transport when we are moving towards cold water immersion. If cost is certainly an issue, and I think it is for many of us, as well as access, the Taco Tarp is a really great newly studied opportunity. And TACO stands for Tarp Assisted Cooling Oscillation. So we have a great ability here to, as long as we have colleagues or individuals that are willing to help us, being able to oscillate that tarp, being able to break the thermal barrier. It is, of course, very cheap. It's not extensive to deploy, but it is not a total immersion. So as you add more water and add more ice, that tarp is going to be heavier. You certainly do not need to be carrying the individual in it, just having the opportunity to oscillate them. But again, this is something that if you have out on site wherever you may be, to be able to utilize prior to transport, or if you do not have the option for cold water immersion, this may be an opportunity to utilize. And then, of course, the gold standard for any type of heat stress emergency is going to be cold water immersion. So you can see Dr. Casa and some individuals from Corey Stringer Institute there on the left. And I think many of us are familiar kind of with that setup, with a Rubbermaid tub, kind of on a sideline for those of us that have worked in athletics. This is something actually that we're utilizing on our construction sites, which is just a clean laborer's cart. The laborers were nice enough to put a spigot at the bottom, so that we could drain it if necessary. And again, thanks to Jess and Lauren, my team members, for their willingness to pose and for me to post this. A cart like this, unfortunately, does require probably 100 gallons to be adequate. So if that is an issue, that certainly can be a barrier. But just like when we're in any other type of tub, make sure that we are supporting an individual, even if they are coherent and responsive when they get in. That may change even though they are being cooled. So please make sure that we're getting a towel around them here. We're utilizing pool noodles just because of the depth of it underneath the armpits. We want to try and cool as upwards to the neck as possible. Again, removing as much clothing and PPE as possible so that individuals can cool and appreciate as much surface area as possible. So when we're talking about cold water immersion, cool first, transport second is the new tagline. Please keep this in mind. It may not be appropriate as soon as EMS shows up to transport. And I think that is very challenging for environmental health and safety individuals to understand if they're not well trained. We need to make sure that we are cooling on site if we have the appropriate means to do so. We want to cool to equal to or below 102 within 30 minutes of that recognition. So there is a timeline there, right? When we talk about strokes, we know time is brain, and kind of the same can be said for heat emergencies as well. It can be essentially any major organ that you want to pick, but we want to make sure that we are cooling appropriately, quickly, and adequately before we transport. Cool to the neck if possible. Again, increase that surface area. And again, stop cooling when the core temperature reaches 102, and then have the opportunity to transport. Depending upon this last bullet, activate EMS timing. Depending upon the publication that you will look at, words matter, and some of those publications say cool to 102 and then activate EMS. And something personally that I certainly would not do. I'd much rather have EMS activated and on site and continuing to cool. And again, Susan did a great job talking in day one about her relationship with EMS there in San Antonio. And I can't encourage you enough to develop a relationship with your EMS. Let them know that you're going to cool first on site and transport second, because again, a lot of people think that the air conditioning in the back of the ambulance is going to be adequate, and we certainly know that it is not. All right, and then just jumping into the last objective here. If you're not familiar with this ANSI and ASSP document, this is something that came out in 2024. It is specific to construction and demolition operations, so if that is the setting that you're in, this would certainly fit. So just another opportunity for us to have in writing what should be done. So we know that when warmer weather first begins, or those that have not been exposed, we want to make sure that we are keeping an eye out, assessing those patients, going through an appropriate acclimatization policy if we have one, or continuing to work towards one. Assessment of wet bulb globe is the gold standard. And again, we're hearing that from ANSI as well as the ASSP. So it is not just an athletic training thing. It is the gold standard across multitude of industries. And if you are struggling on your site, potentially to get buy-in or understanding of what is necessary, this is a great standard, because in it states that there should be a separate area on each work site that contains extra supply of water, ice bags, cooling fans, towels, and at least a cold water immersion tub or tarp. So we, again, can't stress enough, cold water immersion is the gold standard. Please make sure that you have those materials on hand before they are necessary. All right, and then just to wrap up here, quickly, we'll just go through some aspects of the heat stress management plan and do a critical appraisal here. So for your existing plan components, kind of 5 different things that you want to just assess. That there are training on signs and symptoms of heat illness. Again, if that is particularly you, hopefully you can continue to educate others that are on site, whether that be EHS or foremen or supervisors or whatnot. Make sure that there is an appropriate provision for water, rest, as well as shade. Again, having a specific emergency action plan for heat stroke. I know this is something that's very common in athletics, but we want to take those best practices from those other settings and be able to utilize them on our job sites. Encouragement for acclimatization, and I think that will take a continued cultural shift. So the more that we can do with our clients, with our patients, to put and implement acclimatization standards, the better for everybody. It will continue to trickle down. And posters and awareness materials certainly posted out on site are a good passive way, but that is a piece of the heat stress management plan. So when we talk about area assessment, we know that acclimatization protocols are often vague and they lack phase work schedules or tracking. So just something to consider there. When we're talking about monitoring and surveillance, we know the wet bulb globe is the gold standard, but there may not be a formal way to track it. We may only be considering it when it is hot. We may only be considering it in one area of the site or when employees start to show symptoms. And then again, let us not forget about the opportunity to document this information appropriately and so that it is shared with multiple levels of whom we are working with and those decision makers on site or on the manufacturing floor. Again, everybody is trying to mitigate heat risk as much as possible, but really where are the roles and responsibilities for the enforcement activities on site? Again, something important to keep in mind for your activity or for your management plan. Again, emergency response, right? Talking about that real-time cooling method. Is it ready? Is it there? Is it practical? It's great if you have a tarp. It's great if you have a tub, but do you actually have access to the other means of cold water or ice? Rectal thermometry, again, if you're able to utilize it. So when we talk about data-driven decisions, we keep in mind the NATA as well as the OSHA recommendation of that progressive work rest schedule over 7 to 14 days. Again, very easy for those of you that have worked in the athletic setting or coming from the athletic setting into the industrial setting, but something that we need to continue to do more work in and on. And we see that studies show that upwards of more than 50% of heat-related fatalities occur in the first few days on the job. Again, it's not typically the first day, but individuals are predisposed, they're dehydrated, they don't have the ability to dump heat, they're already exhausted, and their body is unable to keep up multiple days on end. Monitoring that heat stress through the wet bulb globe. Again, I love the addition of the AIHA tool rather than the OSHA heat stress tool. I think that this one is much more practical, so I appreciate that being passed along. How are we integrating symptom reporting and surveillance? How is that being tracked? How is that being aggregated? What trends are we seeing? Where are we seeing those trends? Is this a particular area on the site? So are we, again, assessing the environment as well as assessing the patient population? Making sure that we are adding those tiered emergency response protocols. We've talked about rectal thermometry quite a bit. Again, deploying the cool first, transport second, and that is going to require some training for individuals on site because we think as soon as EMS shows up that it is time to go. And in this particular instance, it may not be. And one thing that I certainly can do a better job on transferring here into the industrial side is providing annual drills, whether that be with your staff members or with your clients or whomever you're working with on site internally and externally, to whether it be tabletop or actually hands-on exercises to execute heat scenarios. Account for individual risk factors. Again, we talked about that. Do you have an opportunity to collect some of that data confidentially? Are you able to assess these underlying conditions utilizing their BMI potentially or their fit to work and putting together individualized work to rest or hydration plans? I know that is easier said than done, but that is the direction that we certainly should be moving towards. And then as we wrap up here, establishing a heat safety scorecard, something again that can be utilized on site each and every day, assessed each and every week or month. How many heat-related incidents are you seeing? Again, this could be utilized across an entire business unit if necessary. The percentage of employees that are completing heat illness training, right? That's something, again, that can utilize in a toolbox talk or a lunch and learn or something like that. Educating others on the number of days where wet bulb globe temperature has exceeded the appropriate thresholds through NIOSH or ANSI or OSHA. Okay? And again, not just enough to take it and document it, but we need to make sure that we're sharing that material. And then lastly, providing those tailored supervisor trainings, right, including those scenario-based learnings. As many of us may be the only medical provider on site, we want to make sure that we have help, right? And that people can continue to assist us in the event of heat-related illness. So going through different supervisor training is appropriate. So additional resources that we have here, the NIOSH heat stress has its own separate side of the website, so it's something important to check out. I think most of us, if you're not familiar with the Corey Stringer Institute, I would encourage you to get familiar with it if you're an athletic trainer. But you may not necessarily know that they have a heat safety and performance coalition side of Corey Stringer Institute, and that is focused on the industrial worker, the manufacturer, as well as the agricultural worker and warfighter. So those are some very specific standards that are coming out of KSI, specifically for occupational athletes, as well as tactical and military athletes. And they continue to do studies. They've partnered with Mission as well as Magid to manufacturers of different PPE materials to continue to test their materials. You saw the study from Cold Vest as well that went through the Corey Stringer Institute. So encourage you to do some more research on the Heat Safety and Performance Coalition. And then again, OSHA has its heat illness policies as well. So I appreciate everybody's time. Certainly open to questions, but my information is here. Certainly leave it up. If anybody would love to connect, talk about what you're doing well. I think it's the only way that we continue to get better is sharing of ideas, continuing to challenge each other appropriately. And that's how we ultimately help our profession as well as help our patient and client population. So thank you all very much.
Absolutely awesome. Thank you so much, Dr. Daly. So as he said, guys, we are open for questions now. I already see one in the chat for you, James. Mike is asking, you discussed upper extremity cold bath immersion as a preventative measure. This has come up as an idea to use in my setting, but hygiene is a concern. Have you seen chlorine, bleach, etc. used to mitigate the hygiene risk associated with several employees using the baths?
Yeah, it's a great question, Mike, and I thought about talking about it because, of course, if you have even a small open wound, people may not be willing, or unfortunately, you may not want them utilizing it. I have not seen anything like that. Personally and anecdotally, I would certainly lean towards a chlorinated water rather than a bleach solution because, of course, you have some concerns there with skin as well as an eye splash. But I would love to look into it a little bit more. It's not something that I'm super familiar with, but I appreciate the question. And if you don't mind, reach out and let's do some digging on it ourselves.
Awesome. And I know one thing, I think we did try that at one of our sites, and I would say sediment and the water getting gross is the first thing you want to make a plan for. We tried sediment trays, all sorts of things. So that is a tough one. The military ATs should probably have some perspective on that.
And let me just add, because you get a segue there, where I'm so grateful that H2F is going to continue with athletic trainers in the military. So we're going to continue to get some great outcomes from that setting and some continued best practices. So a great move and a great opportunity for athletic trainers the week of July 4th. So.
Yes, for anyone who missed the announcement, H2F reversed their decision yesterday, I think, maybe day before. Yes. Awesome. Any other questions, guys? Just drop them in the chat. I know I had a question for you, James, on, you kind of talked about our relationship with EMS, right? And that's definitely something we really went through when I moved here and took a good bit of outreach. What advice do you have for people who need to align this emergency response care and need to develop that relationship? Where would you recommend they start? What are some things that they should be sure to do, and so on?
Yeah, I think, again, those that are familiar with the athletic setting that, have covered football games, and you get the same crew there week in and week out, for multiple seasons, it becomes much easier. When you were talking on Monday about your work in San Antonio, I don't know who's coming, right? I don't know what EMT or paramedic is showing up on that particular site that day. So it comes down to that integrated communication between professionals, right? We're all here for an appropriate patient outcome. The sooner we can start that communication, the better. I don't think that it's very helpful when EMS shows up on site, right? If necessary, hey, let's have that appropriate discourse for patient outcome. But it goes a lot smoother, of course, if you have the opportunity to connect ahead of time. And oftentimes that truly it could just be reaching out and saying, hey, I'm new to the area or I'm new to this setting. I see that we're going to be working together potentially on site. These are some of the things that we're doing that we're going to have on site, so that when you show up, this is what you should expect, and what are the things that we should expect of you. Of course, many areas of the country have gone through some of this similar discourse when we talk about spine boarding and back boarding. And I get it. As an EMT, when you show up on site, it's becoming somewhat your responsibility to get the patient under medical control and get them to where they need to be. And sitting, waiting to cool is certainly not something that I learned in EMT school. So continue to educate, right? Continue to say, hey, we're all here for the appropriate outcome. Reach out to your local EMS provider, EMT provider. Be willing to put on a short workshop or a virtual lunch and learn or something like that. If your site is not very robust or large, get the blessing to invite some individuals from local EMS out to your site. Show them what you're doing. Show them what you're going to do in the event of an exertional heat illness. Nobody likes surprises, right? No, especially medical providers. We're used to them. But if we can mitigate those surprises, even better. Continued communication, appropriate discourse, and education, I think, are the right ways to start and providing those better outcomes.
Definitely. And like you said, you really expressed something that I think you have a unique perspective on, having that EMT background, right? Which is, when they show up to help is probably not going to be the time to educate them on what you believe they should be doing.
It may be, right? It may be. Unfortunately, we have to put our foot down, right?
Mm-hmm.
If we know that this patient is not cool enough to transport, right. But again, it's very challenging. Tensions are already high with people. We want to stick up for our patient and do what is right for our patient. But it goes a lot smoother, of course, if you have that communication ahead of time. I'm sorry to cut you off.
And I've seen a lot of them will just say, this is our binder with our protocols in it. And that's what they have to work with. So knowing that medical director in your city over your EMS is like, they take orders from the top. So that's really helpful to know them. Awesome. Shumansky has a question. Hey, Shumansky. He's asking, what size tarp works best for the taco method?
Good question. I think if you could probably get an 8x10 or an 8x12, it's not so cumbersome. Again, you're not really trying to hold a ton of liquid in there. You will need some more people in order to oscillate it. But for your larger individuals, you want to make sure that you've got enough overlap. So I think an 8x10 or an 8x12 is pretty appropriate.
Awesome. All right. Any more questions from the audience? I definitely can ask a couple more, but want to give people the chance to. What did you say, Shuman? The QR is not working. What is it saying?
The QR code to do the certificate, it said check back later.
That's new. Oh, Did you see? I posted a link in the chat. Hold on, let me.
Also, for the rectal probe, I've read where it says 4 inches. I've always heard for most accurate, you should go 6 inches. Somewhere in between, I guess.
Yeah, everything that I've seen in published material is 10 centimeters. So that's 4 inches. I've never certainly sat there with a tape measure to measure it.
This concludes the IETS On Demand Continuing Education Program video. To claim your CU, you must be a member of the Industrial Athletic Trainers Society and complete the From Claim Your CU found in the YouTube description. If you have any interest in learning more about what the Education Committee has to offer, reach out to the email address on your screen. If you would like to volunteer your time to speak on a topic that interests you, please reach out. Thank you and stay safe.